Hi, my name is Gary Alton. I'm the Managing Partner of the Employee Benefits Division, a key division with the Partners Group. Today's seminar is going to cover three important topics. One, it's going to provide an update on the healthcare reform and what's going on currently with all the new recent regulations and rules that were released. The second seminar or presentation is going to give you an overview of a wellness program that we've initiated with a local insurance carrier. And the third discussion is going to talk about health plan alternatives. It's going to focus on defined contribution as well as a captive risk solution that will allow employers to move from a fully insured to a bundled self-funded program. So hopefully once you have a chance to watch these videos, you'll find them very educational, and it will introduce some unique options for you to consider at your next health plan renewal. I think one of the key things to wrap up is TPG is more than just talk. We actually deliver on what we commit to, and really one of the key things that we look for is delivering results. Thanks.
Gary's right. We've been talking about healthcare reform. Feels like of the 200 collective years of experience, about 150 years of that has occurred in the last 4 years. It feels like we've all aged that much, because looking back on the first time that we brought a large group of folks here to the Partners Group to start talking about healthcare reform, it was May 2010, just shortly after the passage of the bill. And it feels like that's about all we've been talking about since then. And there's certainly a lot to keep track of. And so this morning, we're not going to go over, we're not going to go back to 2010 and all the changes. What we really want to focus on is there has been new news. And that new news in the last month was about the final rules being released for the employer mandate, and just a couple of weeks ago, the final rules being released for employer reporting. So that's what I'm going to focus on. Before we get there, though, we've got a slide that you can all borrow for your upcoming benefit enrollment meetings. And this cartoon, it says, if you have any questions about our healthcare plan, take it up with the Supreme Court. So let's first talk about the newly released final rules for the employer mandate. Just a quick reminder for those who may not be entirely familiar what the employer mandate is. It is the requirement that applicable large employers, which the law defines as any employer with more than 50 full-time equivalent employees, it's the mandate that says, beginning what was originally going to start in 2014 but has since been delayed to 2015, that those employers must offer minimum essential coverage that is both affordable in terms of premium deductions from your paycheck and offers a minimum value to those employers or employees. And if you don't do that, then we're at risk for some non-deductible excise tax penalties. Now, depending on which way you violate the employer mandate, then determines how big of a penalty you might be facing. There are really two types of penalties under the new law. There's the sledgehammer penalty, which is the one that you really want to make sure that you avoid. And that is the one that is most significant, not because of the unit volume. The unit volume is actually lower than the other penalty. It's $2,000 a year versus $3,000. But the way that it's calculated, the sledgehammer penalty is assessed across your entire population of full-time employees, minus what was 30 exemptions and now has increased for at least a 1-year transition to 80 exemptions. So if you are a large employer, and I know we have some pretty large employers in the room, multiplying a $2,000 annual non-deductible excise tax across your entire population of full-time employees is a very expensive reminder that we should be offering insurance to substantially all of our employees. So that's the one that we've really been working to ensure that our employers understand how that calculation occurs, who do they need to offer coverage to, and understanding that they meet those minimum requirements. The second penalty is the tack hammer penalty. And this penalty is generally less worrisome to our employers because it's not assessed across your entire group of full-time employees. It's assessed on an individual basis. And this penalty is triggered only when the coverage that you offer your employees is deemed unaffordable, meaning that it exceeds 9.5% of your employees' household income, or the coverage that you offer doesn't meet the minimum value requirements. So in most cases, employer plans meet that minimum value requirement. So it's really around contribution that may trip you up. But because, again, it's only assessed on an individual basis, it would take a while for those types of penalties to add up. So nothing to ignore, but the sledgehammer definitely is the one that gets our attention. So let's talk about some of the, now that we've done a quick reminder about what the employer mandate really is, I'm going to give you a Cliff Note version of what changed in the final rules that were issued last month. We'd been living for 13 months with what's called interim final rules, and even though those interim final rules were several hundred pages, they left a lot of gaps in terms of really explaining how the employer mandate was going to be administered. And also there were some worrisome provisions that were going to cause our employers a lot of stress. The good news is when they released the final rules last month, a lot of those holes in the initial rules were filled, and there was some really helpful transition relief for some of our employers. So the first transition relief is that if you're a mid-size employer, you've got one more year. A mid-size employer, you're still an applicable large employer if you have more than 50 full-time equivalent employees, but if you have between 50 and 99 full-time equivalent employees, the employer mandate won't apply to you until the beginning of your first plan year in 2016. So that's one more year that mid-size employers have to really worry about the risk of penalties. So here's a couple. If you're on the edge, let's say you've got 105 employees and you think, hey, we're going to get down to 99 really quick. There's actually some rules so that we can get that 1 year delay. There's actually some rules written into this transition relief that says, as of the date the final rules were issued, which was February 9th, employers cannot reduce their workforce in order to fit in that 50 to 99 window. The other thing you can't do is if you're in that window and you already offer benefits, the transition relief won't apply to you either. And there'll be a certification process as a part of the employer reporting that basically says if you want to apply for that 1 year transitional relief and you're a mid-size employer, you have to certify that you didn't reduce your workforce to get that transition relief, and you have to also certify that you didn't discontinue benefits for that year. So the question is, well, how do you do that calculation? How do I know if I'm a small group and I don't even have to worry about this, a mid-size employer and I may qualify for that transition relief, or a large employer and unfortunately we're going to be stuck with it effective 2015. Just a quick reminder about the calculation. If you're confused about how to do the calculation, you're not alone. It's not exactly a quick and easy head count. What you do is you first count all of your full-time employees. And so those are employees working on a regular basis, 30 hours or more per week. Then you take your part-time employees and aggregate their hours, divide by 30, or 130 for the month, to determine how many full-time equivalents your part-time employees make up. You add those two numbers together, and that tells you how many full-time equivalent employees you have in the year. So for 2015, what we're going to do is employers have the option to choose any 6-month consecutive time block you want to complete that calculation for 2015. In the 2016 and beyond, the way that we're going to calculate if you're a large, mid-sized, or small employer is you average it over the entire calendar year. So in this first year for 2015, you can pick any 6-month block you want in 2014 to do your calculation. Another key provision that was released in the final rules and the risk of the sledgehammer penalty was significantly reduced, but only for 2015. The sledgehammer penalty prior to the final rules being issued was going to be triggered if any group didn't offer minimum essential coverage to substantially all of its full-time employees. In the initial rules, substantially all was defined as 95% of your full-time employees. In the final rules, that threshold for triggering the sledgehammer penalty was reduced for 1 year only to 70%. So that allows employers the opportunity to really slowly transition, if you're not already offering benefits to the majority of your employees, over a 2-year time period to get up to that 95% offer rate to avoid the sledgehammer penalty. The 70% offer rate is only for 1 year. It will go back up to 95% in 2016. The other change to the sledgehammer penalty, again, this is only a 1-year transition relief, is that the sledgehammer calculation has been softened a bit. And the way that in the interim proposed rules that your sledgehammer calculation was going to occur is you take all your full-time employees minus 30 exemptions multiplied by a $2,000 annual penalty. In the final rules for 2015, that 30 exemption was increased to 80. So for mega organizations, that exemption change, actually doesn't have a material impact. But for groups who are 120, 130, who may have like a management carve-out plan or something like that, that change in the exemption for 1 year is actually pretty material and allows for a good transition from 2015 to 2016. The exemption will go back down to 30 in 2016. So again, just a 1-year kind of softened entry into the employer mandate. Another transition is our transition relief rule in the final rules are that for fiscal plan years, so non-calendar plan years, the employer mandate will not apply to until the first day of your plan year, beginning in 2015 if you're a large group, and in 2016 if you're a mid-sized group. So we don't have to worry about it being right on January 1st. I'm not going to spend any time this morning talking about the look-back periods and measurement periods because we would be here all day. But it seems like an elephant in the room if we don't mention it. So in the final rules, there were some clarifications around how employers will define and who are full-time in your organization, and so the final rules clarified the optional safe harbor calculation that allows employers to apply a wait and see method to variable hour and seasonal employees, so you don't have to offer them coverage immediately upon hire. And it also defined an alternative monthly measurement option. If you have a lot of seasonal, part-time, variable hour employees, this part of the rules, this is very complicated, and we really encourage you to reach out to a benefits partner to help you understand how this applies to your group. But again, we won't spend much time talking about it this morning. Finally, the long-awaited employer reporting rules were released just a couple of weeks ago, and the good news is, we don't have to worry about this in 2014. We have the first reporting is going to be due the first quarter of 2016. We're going to be reporting on who we offered coverage to in 2015. So it's not as though there's not work to do now, because we need to ensure that all of you understand what's going to be required of you, that you have the systems in place to track the necessary information, and then whether that's through your payroll system or your HRIS system, and then that you're going to be well prepared by the first quarter of 2016 to meet those requirements. There's actually 2 sets of reporting requirements that are due. The first set of reporting is going to be due by issuers. So issuers are self-funded health plans. If you're fully insured, it's your insurance company. And that set of rules is basically reporting to the IRS and reporting to individuals, showing that we had insurance. So we don't have to pay the individual mandate or the tax penalty when we file our taxes at the end of the year. Then there's a second set of reporting requirements that applies to large employers, applicable large employers. And this set of reporting requirements is really around ensuring that the IRS knows what large employers paid and or will pay, and which large employers offered that minimum essential coverage to their full-time employees. So they can track penalties, they can calculate any non-deductible excise tax penalties at the end of the year. And those two things at the IRS go together to ensure everybody's got the coverage that's required of them. So the good news is that there was a lot of pushback to when the initial reporting rules, and they were really gray, first came out. There was a lot of employers who screamed and just said, "Are you kidding me? We're trying to do the best thing. We're trying to offer coverage. This is such an administrative burden that I'm going to have to hire more people just to get through this process." And it appears that the IRS really listened, because there's a lot of good simplified reporting rules that were issued in those final regs. So the takeaway on all of this is that make sure that you're working with your benefits partners, with your payroll systems, to make sure that your system that they understand these new rules. I mean, they've only been out for 10 days, but we certainly knew they were coming, that they understand the new rules, and that your systems are ready to support what's going to be required of you come 2016. So you don't have to do a lot of manual work when that reporting comes due. The lesson we've learned through this last 4 years is things change constantly, and we don't have a lot of warning. We think we've got all these ins, right? But unfortunately, we don't have a direct dial to HHS. So we're surprised by many of these changes. We will continue to be surprised by delays. That's just should be expected in the next year as we continue to move forward. So let us know if you have any questions, if you need any assistance in any of the areas that we just briefly covered.